So our final speaker is Sarah Levitsky, and Sarah did her practicum with the Missoula City County Health Department. Her site mentor was Haley Devlin, who is the public information officer there for the COVID team at the Missoula City County Health Department. And Sarah's presentation is titled Health Information Acquisition During COVID-19 Pandemic in Rural Missoula County. So Sarah, I'll let you take it away.
Thank you, Lee. Good afternoon, everyone. My name is Sarah Levitsky, and I will be presenting my applied practical experience that I completed this semester. All right, so I produced 2 deliverables for my applied practical experience, focusing on the following competencies: interpret results of data analysis for public health research, policy, or practice, communicate audience appropriate public health content, both in writing and through oral presentation, and describe the importance of cultural competence in communicating public health content. The first deliverable I produced was a survey on the Missoula County residents regarding their sources of COVID-19 information and levels of trust. And my second deliverable is a report on the survey findings with this presentation and 2 infographics, which I included at the end. All right. A study conducted by Reuters and Oxford University showed that the United States utilized news sources less as compared to other countries, relying more on social media and other digital media. There were 8 other countries in this study. And the survey that we used collected basic demographic information, as well as the sources of information accessed, level of trust, and frequency in accessing these resources. We used broad demographic categories in order to preserve respondent anonymity, and questions analyzed were closed-ended, mostly utilizing the Likert scale. In order to gather a sufficient number of responses for our survey, we used 3 methods of sampling: in-person convenience sampling, web-based convenience sampling, and snowball sampling with phone lists, all sorts of fun things like that. All right, our participants self-identified their area and age groups, and the demographics of the 134 participants were relatively evenly distributed by area of residence. Interestingly, more than half of the sample was in the 35 to 60 age range, which is not quite the same as Missoula's actual demographic. Analysis of the survey data showed that the information sources accessed most were those via internet from healthcare providers such as doctors and nurses, as well as their family and friends. Results showed that participants continued to trust their initial information sources they accessed at the beginning of the pandemic, as shown in the table, with healthcare professionals maintaining the highest level of trust, both in count and percent that still trust. Magazines and radio had low levels of trust initially, with only 2 and 8 individuals respectively. To assess differences between age groups, we calculated the mean response score for each group, then used an analysis of variance to determine whether there were any statistically significant differences between groups. We found statistically significant differences in the use of social media by age group and by area. Based on the group mean, the 35 to 60 age group utilized social media the most, followed by the under 35 group, and lastly, the over 60 having the lowest group mean. Based on the group mean, the urban group accessed social media most, followed by suburban group, and not shockingly, rural group having the lowest group mean for social media. Data analysis on the use of the Missoula City County Health Department website also showed statistically significant differences by age group and area. The mean for the over 60 age group was statistically different from the other two groups. The 35 to 60 group reported accessing the MCCHD website most frequently, followed by the under 35 group, with the over 60 age group reporting the lowest usage. The mean for the rural group was statistically different from the other two groups. Both urban and suburban groups accessed the website more frequently than the rural group, which is likely impacted by access to broadband internet and cell phone access. The results of the survey provided us with interesting insights into illness information and how different groups acquire relevant health information and their level of trust in that information. We found several similarities with the national and international studies mentioned earlier in the presentation. Our study found widespread usage of digital and online platforms to acquire information, particularly among age groups. Additionally, though the internet was the most widely used source of information on COVID-19, only a moderate level of trust was reported in our study. Similar to other studies, respondents reported even lower levels of trust in information shared on social media. The most trusted source was healthcare providers, although access to this source is limited within Missoula County, particularly for those without healthcare insurance coverage. Given the statistically significant differences found between age groups and by area type, we need to have different approaches when providing health messaging to rural versus urban groups and the age group of over 60 versus 60 and under. Conclusions. We need to gain a greater understanding of how people acquisition their health information. This can be done by improving our survey with more specific questions and obtaining a more representative sample, particularly sampling rural and older populations, as they can be more difficult to reach. Participation could be improved by partnering with existing community groups to promote the survey, as well as providing the survey in multiple languages, as I only provided it in English, unfortunately. We will then be able to use this information to continue improving health messaging to Missoula County residents by altering how we message different groups, as we have a diverse group in Missoula. Here are my references. And I'll just leave this up for a second, but these are the two infographics I created. The one on the left is for healthcare providers, and the one on the right is for public health practitioners. And lastly, here's some information about my community service project to clean up a section of the Clark Fork River near Tura, Montana. As you can see, we had some recycling and trash. I did this last year. It was really great opportunity to get involved and be a part of the community. And that's all I've got. So thank you all. I've learned so much about conducting a community survey and how different groups access information related to their health. Special thanks to Haley Devlin, my mentor, and Lee Taggart, my advisor, for helping me get this all together. Please let me know if you have any questions.
Great job, Sarah. Way to go. Does anybody have any questions for Sarah and the work she did? It was so interesting to learn about, some things we assume, but I think having it in the information you gathered, and you did a great job here, Sarah. So congratulations. It's been a pleasure working with you. I'm gonna see if anybody has any specific questions or thoughts about Sarah's survey and the work she did. Oh, we have a quiet group today, which is Just fine. I think at this point, I'm going to say thank you to Sarah, to all of you for an amazing job. Well done. I also want to give a big thanks to all of our site mentors and for working with the University of Montana School of Public Health and the Masters in Public Health students. This is what makes the program valuable, is having great sites and great site mentors. And I think from everybody at the university, we say thank you to you. And without further ado, I think we will sign off for the afternoon, and congratulations to the 4 of you for finishing your applied practicum experience presentations today. Congratulations. Thanks, everyone.
Thank you, Lee.
Thank
Thank
you.